All right, I am here with my fellow vaccinated nurse, Jen Kennedy. We're going by that name, right?
Oh yeah.
Okay.
Jen Kennedy.
And she is 9 weeks postpartum. She's back from maternity leave, and Stella's gonna get her groove back. We're diving back into the injectables. We worked a little bit on the C-section scar, and this is gonna be the first time I'm injecting someone without a mask in quite a long time. It's also the first time in a long time she's gotten injectables. 2 years since fillers?
2 years since fillers.
How long since neuromodulator?
11 months.
Okay. First question, first rule of Fight Club. Don't talk about Fight Club and don't inject things into women who are breastfeeding. She is not breastfeeding, and that's usually when women will come to start their injectables again. You can do lasers while you're pregnant. You could do some lasers while you're breastfeeding, but you don't want to inject elective chemicals into the body, whether they're been studied or not, most of which have not been studied. So we're gonna start with her neuromodulator today, and we're gonna hit the basics. I usually like to introduce things just a little bit at a time. The face elasticity is changing. It's only been 9 weeks. I know she looks amazing, 9 weeks postpartum, but we don't want to do too much because it really takes it could be 6 months until her body kind of adjusts, not just the face, but also the body. And then we can get things on a little bit at a time. And most importantly, I hope she doesn't bleed on me. Now that
I'm allowed to drink wine.
Now that she's able to drink wine, she's doing so.
It's the first time I've been injected with the vibrato too. It feels.
Oh, really?
Yeah, I don't feel anything.
That's pretty good, right?
Yep.
Good.
Oh, I'm back.
Thank you. She's also assisting me.
I'm also assisting.
She's also assisting me.
Can't help myself.
I know. Raise your eyebrows. Good. You honestly don't need enormous amounts. Most people need a little bit more.
Where I see it the most is in my neck.
Really?
Mm-hmm. So I haven't done any of my Vivace oral therapy treatments or, so it's time to hit it with a little neuromodulator too.
So I usually, like postpartum, I'd like to certainly optimize the facial shape, again, using conservative amounts to start. Then I'll go to skin tightening, because again, once women are back to their ideal weight, you want to work on the elasticity of the skin. I usually don't want to do the skin tightening treatments on the way down with the weight. And then I can introduce, as I do the skin tightening with either things like oral therapy or Vivace, that's when you could start adding a little bit more injectables if you do need. A lot of this has to do with how much weight gain or weight loss there's been. She's moving her chin a little bit. Good. And then she's going to hit me with the neck bands. Good. I usually inject while the patient is flexing. Relax for a second. It looks painful. It's not a painful area. Flex. And you go right down the band here. You want to make sure to get the full band. Flex. You can also put a little bit along the jawline platysma. Used to call this the Nefertiti lift. Good. That's it.
Mm-hmm. And I gained 50 pounds.
Did you gain 50?
50.
50 people.
50. The last 10 pounds when I was on bed rest. Yeah. So I felt my face puff up and then go back down. So we're getting there.
One would think this is filler. These are her cheeks. I know you're jealous. Okay, lean back. Mm-hmm. That doesn't mean that she can't get something laterally. I do a little small amounts of volume replacement laterally. I really want to avoid the mid-face because that's usually where people tend to see the weight of pregnancy. I'm going to put a little bit in the chin. I liked your dimple. I'm not getting rid of your dimple.
I love it. It's my grandfather's.
You're good. You're fine. She keeps trying to assist. It's the nurse.
Always working.
I have to see her every day, so I have to do a good job.
Especially now that masks are coming on.
That's right. That's right. And whenever I inject the lateral face, I always notice if the earrings are hanging in a certain way. And I do like to inject with the earring in. And I give a little support so the earring sits differently. Good.
I feel like a new woman already.
You're feeling the job. Turn your head a little away, just like that. Stretch. Okay, hold right there. I'm not done. I want to massage and then take a look.
Felt nothing.
It's your left side is your heavier.
But I felt nothing. Pricks, but.
You get more red than anything else.